Introduction. This disease is an acute problem. In many people around the world, hepatitis A is caused by the hepatitis A virus. The disease varies from a mild illness, lasting 1 to 2 weeks, to a severely disease, which lasts for several months. Many patients can have a complete recovery. Hepatitis A does not end up to chronic liver disease. In some cases the disease can become very serious, resulting in fulminant hepatitis, liver coma, or sometimes death. Hepatitis is totally age-dependent. For most of young children, they remain asymptomatic. Fatality rate is 2% among adults over 50 years of age. HAV is a picornavirus that can enter the bloodstream via the intestines. It is then transported to liver cells. Reaching the liver, the hepatitis A virus begins to replicate. HAV is also excreted in feces and also in stool, which is its major transmission route. It is the most common type disease in most countries of the world. An estimate is that about 3,000 new HAV infections occur annually in most countries of the world. HAV virus. HAV is a single-stranded 27 nanometers, non-enveloped, icosahedral, RNA-type virus. It was first identified by immunoelectron microscopy in 1973. It belongs to the hepatadenovirus, genus of the Picornaviridae. According to recent researches, HAV is placed between typical picornavirus and insect picorna-like viruses. This virus utilizes host cell exosome as protective envelope from antibodies-mediated neutralization. There are 7 different HAV genotypes have been identified, out of which 4 are only able to infect humans. HAV RNA has a length of 7.5 kilobits and it consists of 1,5 non-coding region of 740 nucleotides. 2. Coding region of 2,225 nucleotides. 3. Non-coding region of approximately 60 nucleotides. Transmission of virus. 1. HAV is transmitted, fecal-orally, either by person-to-person contact. 2. Using contaminated food or water. 3. HAV is mostly restricted to humans, and is not considered to be a zoonosis, animal diseases. 4. HAV transmission is also possible by blood transfusion, but it is extremely rare. 5. When clinical symptoms appear, the HAV can be isolated from the feces of patients at least 5 days before symptoms. 6. HAV is detectable in the feces up to 2 weeks after the start of jaundice. 7. Sometimes fecal excretion of HAV up to 5 months after infection can occur both in children and immunocompromised persons. 1. Person-to-person contacts. HAV infection is transmitted, due to fecal-oral route, from person to person. HAV patients are infectious during the 1 to 2 weeks before start of jaundice, and the risk of transmission reduces and it becomes minimal by 1 week after start of illness. Risk of HAV transmission is increased where there is close person-to-person contact, for example among infants, young children and those with learning disability and daycare centers. The risk is also increased where there are poor hygiene standards present. Most children have unrecognized infections. They play a major role in HAV transmission, and serve as a source of infection. HAV can also be transmitted by sexual or anal contact, or by oropharyngeal secretions. 2. Food and water. Contamination of water supplies with infected feces occurs where not proper sewage disposal is maintained. Also, food washed in contaminated water, or prepared by an infected person, also cause viral transmission and infection. Shellfish, harvested from contaminated water, also cause HIV outbreaks. 3. Intravenous means. Outbreaks of hepatitis A are very rare, due to blood and blood product usage. Increased chances of infection among injecting drug users is mostly due to poor standards of hygiene, although contamination of drugs and needle sharing are also causes of HIV infection. Hepatitis A percentage is decreasing in better resourced countries due to improved hygienic conditions and sanitation solutions. In most countries, HIV transmission is most frequent among household and sexual contacts. It also occurs among people who travel to endemic countries. Outbreaks of HIV have been reported frequently in injecting drug users and in men-to-men sex relations. HIV infection is common and occurs in early life in underdeveloped countries. Treatments of HIV. Most of the times hepatitis A typically resolves on its own. There is no set treatment for HIV. If a person is infected, then an injection of HIV immune globulin antibodies is given within 14 days. Infection may prevent the development of illness. General measures like healthy diet, plenty of fluids and adequate rest can help make a person feel better. Vaccine for HIV is considered safe and effective. The 2-dose vaccine is administered by injection, with the second dose given 6–12 months after the first. Almost all people given 2 doses of the HIV vaccine develop protective antibodies within 1 month of receiving the first dose, and all people have protective levels after the second dose is given. HIV vaccine can provide protection against hepatitis A for 25 years or longer. No serious adverse reactions are seen to the HIV vaccine. But common side effects may include soreness, tenderness at injection site, headache and malaise. The vaccine is best for people having infection, including men who have sex with men, daycare centers. Mandatory vaccination of school-age children in some countries has reduced the incidence of outbreaks among children.